Let's discuss today DDimer test or deep vein thrombosis. What is DDimer test? A DDimer test looks for D-dimer in blood. D-dimer is a protein fragment, people call it a small piece, that is made when a blood clot dissolves in your body. Blood clotting is an important process that prevents you from losing too much blood when you are injured. Normally, your body will dissolve the clot once your injury has healed. With a blood clotting disorder, clots can form when you don't have an obvious injury or don't dissolve when they should. These conditions can be very serious and even life-threatening to all of you. So, a D-dimer test can show if you have one of these conditions. People also call the D-dimer test in another names like fragment D-dimer, fibrin degradation fragment. Why D-dimer test is used for? A D-dimer test is used to find out if you have a blood clotting disorder. Here these include below. First, deep vein thrombosis, a blood clot that is deep inside a vein. These clots usually affect the lower legs, but they can also happen in other parts of the body. Second, pulmonary embolism, a blockage in an artery in the lungs. It usually happens when a blood clot in another part of the body breaks loose and travel to the lungs. DVT clots are common cause of PE. Disseminated intravascular coagulation, a condition that causes too many blood clots to form. They can form throughout the body, causing organ damage and other serious complications. DIC means disseminated intravascular coagulation, may be caused by traumatic injuries or certain types of infection or cancer. What are the symptoms of D-dimer test? Symptoms of blood clotting disorder such as deep vein thrombosis or a pulmonary embolism. Here these include below. First, let's discuss about symptoms of DVT include leg pain or tenderness, leg swelling, redness or red streaks on the legs. Discuss symptoms of pulmonary embolism. First, trouble breathing, chest pain, cough, rapid heartbeat. Note, this test is often done in an emergency room or the other healthcare setting. If you have DVT symptoms or not in healthcare setting, call your healthcare provider if you have symptoms of pulmonary embolism. Now let's discuss the D-dimer test result mean. If you want to know your test result mean, kindly listen and watch this slide very carefully. If your results show low or normal D-dimer levels in the blood, it means you probably don't have a clotting disorder. But if your results show higher than normal levels of D-dimer, it may mean you have a clotting disorder, but it cannot show where the clot is located or what type of clotting disorder you have. Also, D-dimer levels are not always caused by clotting problems. Other conditions that can cause high D-dimer levels include pregnancy, heart disease, and recent surgery also. If your D-dimer results were not normal, your provider will probably order more tests to make a diagnosis or to confirm. If you have question about your result, talk to your first healthcare provider, I mean to say your doctor. Now the reference concentration of D-dimer is less than 250 Ng/ml or less than 0.4 UL/ml. Note, higher than normal levels of D-dimer level include or may be included pregnancy, heart disease, recent surgery, trauma, infection. D-dimer levels also tend to rise in elderly people, and false positive results may occur if you have rheumatoid arthritis. If your results show abnormal D-dimer levels, your healthcare provider will likely have you undergo additional blood test. Let's discuss the important part of this slide. Treatment for the high level D-dimer. Here are the natural ways to decrease or lessen your inflammation as well as clotting problems. Fish, fruits, vegetables, whole grains, nuts, beans, healthy fats like olive and canola oil. You can eat or use these things in your daily life. These foods pack a 1-2 punch when it comes to helping you control inflammation. First, they offer nutrients such as flavonoids and antioxidants that directly lower inflammation, and as a part of a healthy eating plan, they may help you to lose weight, which eases pressure on the blood vessels and lessens inflammation throughout the body. Though more studies are needed, other nutrients that may control inflammation include the omega-3 fatty acids found in the fish oil and the flavonoids found in dark chocolate, grapes, and some teas. Thank you very much for watching the videos.